Sugar Crush.
You really can't beat all that sugar now, well. You understand? Because you see, the age for diabetes gone down now, boy. It's not no old people thing now, boy. So if it is you don't watch your diet, your sugar level go too high, and you get diabetes and day. You will deal. You want it.
I don't want to hear this.
You don't want to hear it?
No.
Alright, dog. So just let me know the funeral.
What you eat
When
today?
you get
What's
diabetes
the
and you eat a ice cream, you know, what's that cake? 2 ice cream from Cold Stone and you eat it.
free thing, not good
Free
food.
thing you get to.
What do you
Yeah,
have?
we ain't on so.
So I can't eat no anymore.
Yeah, but
Never
not
say
so
don't eat no
much.
sugar.
Not so much. Everything in moderation. Up to now, I never say eat apple yet.
Yeah, and you're trying to eat me too. All that
I'm-
sweetness not good for you.
Because I don't really like fruits, that's all.
So we really like fruits.
I rather like his cake than apple.
She like the dark chocolate.
And you're thirsty. You know you say, you know.
Yeah.
You're thirsty, you can buy a soft drink.
Yeah, just good work.
Juice not gonna work.
Just good.
No, that's just sugar.
The Sprite does crunch all too. So therefore,
Exactly.
No, watch and see you go fall down on your feet.
you will get
Then later down, you
diabetes.
get diabetes. And I will laugh at it.
No, this is not feeling
You're stupid.
I'm not feeling at all. So this talking thing on making me relative.
Hey, watch now. You drink your sugar water by yourself. I am by a bottle of water.
Bring the juice, man. Let me get up and my juice. My head. My head.
Do that one. Yeah, be good. Watch now.
So she wake up now.
Wake up now.
There you go.
There you go. She feeling you know though.
Nah. She can't be on that.
Hey, watch now. Hey, you can't dead you know. Hey, let's get an action on you, Ben.
Like, seriously?
Nah, I can call you.
I'm not my friend, you know.
Like my friend, I
I
call
got
you.
nothing.
Yeah, good. Yeah, my friend. She fainted, man. She really moving. She breathing and thing, yeah, but she really moving.
Ah,
Brain she with what? She faint. You mean how she did? I know she faint. She faint.
Welcome.
She said yeah, then she just faint. Alright. Hey, Larry, carry. So
We.
well, Larry, damn, she could be dying, boy. She's not going to listen to her.
You want me to touch this?
Good evening, Sivas. That seems to be a problem.
Just right up here. I don't know what's for my juice. Just here now.
You described that for the past 2 months.
Mostly sweets, cakes. I don't really like to eat food at all. Eat probably a muffin or chocolate.
Any exercise?
No.
You seem to be hypoglycemic and have type 2 diabetes.
What is hypo? Hypo what?
It's hypoglycemia. This refers to a condition when there's excessive amount of glucose circulating in the blood plasma.
And what is type 2 diabetes?
Type 2 diabetes is a condition when the cells do not respond to insulin produced by the pancreas, and these cells are turn insulin resistant.
So that's why I've been feeling this way.
Well, the reason why you're always hungry is because your body is not able to use this insulin produced by your pancreas, and insulin stimulates hunger. So this accumulation of insulin would cause you to be hungry almost all the time. The reason why you're always tired is because your body not able to use glucose obtained from the diet to produce energy in form of ATP.
And that's why I'm always thirsty.
Well, the reason why you're always thirsty is because when your body produces urine, your kidneys lack in the ability to reuptake glucose from water. And also the reason why you urinate frequently is because your body is tending to get rid of extra sugars present in your body. And you should avoid getting cuts because it affects the high blood glucose levels, affects white blood cells and your repair tissue. Ms. Rivers, by chance is right?
Yes.
I will bounce on anybody out there, you know.
Why would I do that?
It's because high blood glucose levels causes blurred vision and pulls fluid from the lenses of the eyes.
So how can I manage this disease?
Well, to avoid further health problems, you have to focus on 2 areas in life. These are diet and exercise. Your diet should be regulated by the quantity and quality of foods ingested. It should be one high in fiber, vegetables and proteins, and low in carbohydrates and fats, particularly saturated fats. Junk food should be avoided because this contains a high sugar content and materials that build fat. But you could consume complex carbohydrates because this causes the glucose levels to rise at a steady rate, which will give the pancreas enough time to produce insulin, so the levels will rise at a drastic rate. You will be able to be maintained. I want you to take this metformin, and with this regular exercise.
What exactly does metformin do?
This metformin is the most common anti-hypoglycemic treatment for type 2 diabetes. It reduces blood glucose levels and is an insulin sensitizer.
So
It controls your blood glucose levels. I'm going to organize some appointments for you to come in and test your blood glucose levels by DAS scan testing. Okay? So you are going to do this with us.
What are you doing here? Yeah, I didn't want to talk right now, but I never want to talk. Honey, I don't want to talk. Check. No, seriously, what happened? You have what? Young lady. Sorry to laugh at, but type 2 diabetes, you say? Young girl like you? My God. Is it juice thing? How did you just sing? Talk to me about that. I drink no more juice. I'm drinking more well, I'm drinking juice for you, right? Check. Well, you know, we need to do a little research on that, right? Because I, for one, do not know what you need to do when it comes to that, right? So just try not to stress. Drink your juice. Right? Alright, well, you see this link here? Sugar rush Candy Crush. We can check it out. That look interesting. So let's see what we can get from that, right? Oh yeah, type 2 diabetes. Oh, well, yeah, I could work. Alright, let's see. Click on the hit the read it out first.
And they're not long too, so.
Really, I know your attention span.
Exactly.
Something to, wow. Alright.
What happens when diabetes occurs? Type 2, a person still makes insulin. As the disease prolongs, the pancreas makes less and less insulin. This results in the blood glucose levels in the body to not be under control. High blood sugar can cause eyes, temporary blurred vision, which are signs of diabetic retinopathy. Diabetic retinopathy is a disease of the retina. This is the part of the eye that sends images to the brain. Poor vision and blindness are the results of this disease. The blood vessels in the eye weakens and blood and other liquids can enter into the retina. When the fluid makes its way to the center of the eye, it causes blurred vision. There are two types of retinopathy: proliferative and non-proliferative. The first shows symptoms and the latter does not. The macula of the eye can also swell. This swelling can cause legal blindness by a process called macular edema. 2. Feet and skin. There is a loss of feeling in your feet. Common minor problems like small cuts and blisters can escalate more quickly. Some people may need to amputate limbs. 3. Heart and blood vessels. The lining of blood vessels are damaged by high blood sugar levels. Stroke, heart attack, or peripheral arterial disease can arise from this damage. 4. Nerves. Nerves are damaged throughout the body due to high blood sugar levels. The damage is called diabetic neuropathy, which is of 3 types. Diabetic peripheral neuropathy. The nerves which are damaged are responsible for sensing pain, touch, hot, cold. Charcot foot is a deformity that arises from this type of nerve damage. Autonomic neuropathy. This is the damage to nerves that control things like heartbeat, blood pressure, sweating, digestion, urination, and sexual function. Focal neuropathy. One nerve is affected, either wrist, thigh, or foot. It may also affect back and chest nerves, and also the nerves that control your eye. 5. Kidneys. Persons with high blood sugar levels can cause damage to the kidneys' blood vessels. This process is called nephropathy. In some patients, this can lead to kidney failure. Symptoms of a damaged kidney are swelling of the feet and leg. The protein albumin is also found in the urine, which in a normal person it is not present. To help treat with this problem, patients are given medication. 1. Angiotensin converting enzyme inhibitors, ACE inhibitors. 2. Angiotensin 2 receptor blockers, ARBs. 6. Hearing. High blood sugar can cause nerve and small blood vessel damage in the ear, which can lead to a loss of hearing. 7. Teeth. Gum disease, loss of teeth, and a longer healing time to cuts or sores in the mouth. 8. Mental health. Depression. GLUT4 transporters is affected. Metabolic changes in type 1 diabetes. In type 1, metabolic abnormalities stems from an insulin deficiency which affects the metabolism in 3 tissues: liver, muscle, and adipose tissue. Hypoglycemia and ketoacidosis. Hyperglycemia is caused by increased hepatic production of glucose plus reduced peripheral utilization by muscle and adipose tissues. Glucose cannot directly diffuse into cells. It enters by either a sodium-independent facilitating diffusion transport system or a sodium monosaccharide co-transporter system. GLUT4 is abundant in adipose tissue and skeletal muscle. Due to increased levels of insulin, the number of GLUT4 transporters fused to the cell membrane also increases. This allows the diffusion of glucose into cells. The ATP produced from ketosis, from increased mobilization of fatty acids from adipose tissues, is used in the energetically costly process of gluconeogenesis. The acetyl-CoA is a positive activator for pyruvate carboxylase. Acetyl-CoA goes on to form ketone bodies in the liver, which there are 3 types: acetoacetate, 3-hydroxybutyrate, acetone. Metabolic dead end. Body does not use this form. It is very volatile and it comes out in your breath. Diabetics experience this hepatic cirrhosis, which occurs when there is an imbalance between hepatic triglycerol synthesis and VLDL secretion. VLDL is released by the liver into the blood as VLDL particles containing ApoB100. They must contain ApoC11, required for lipoprotein lipase activation, and ApoE for circulating HDL. When VLDL passes through circulation, triglycerol is degraded by lipoprotein lipase. This causes a decrease in the size of VLDL and it becomes denser. The ApoE and ApoC apoproteins returns to HDL, but ApoB100 is retained by the particles. Triglycerols are transferred from VLDL to HDL. In diabetics, lipoprotein lipase, which is responsible for lipoprotein degradation, is low because enzyme synthesis is lowered when insulin level is also low. This results in higher levels of VLDL and plasma chylomicrons. Type 2 diabetes refers to when cells in the body fail to respond to insulin properly. The body produces the hormone insulin, but the cells in the body become resistant to insulin and are not able to use it appropriately, which leads to hypoglycemia. In the pancreas, beta cells subsequently increase their production of insulin, which contributes to hyperinsulinemia, which remains undetected often and can contribute to a diagnosis of type 2 diabetes. When insulin is not used appropriately, glucose cannot enter into the cells in the body, and hence glucose accumulates in the blood instead of going into the body's cells, and these cells are not able to function properly. Glycolipotoxicity is also caused by increased intracellular cholesterol, decreased glucose-stimulated insulin secretion, protein kinase C isoform activation by free fatty acids, which acts as a signaling molecule, causes a decrease in insulin secretion. Upregulation of UCP2 leads to reduction of glucose-stimulated ATP generation. Role of insulin. The endocrine pancreas. The pancreas has both endocrine and exocrine functions. The endocrine tissue is grouped together in the islet of Langerhans and consists of 4 different cell types, each with its own function. Alpha cells produce glucagon, beta cells produce proinsulin. Proinsulin is the inactive form of insulin that is converted to insulin in the circulation. Delta cells produce somatostatin. F or PP cells produce pancreatic polypeptide. When blood glucose levels are low, glucagon, a hormone produced by alpha cells of the pancreas, is secreted. This stimulates the breakdown of glycogen to glucose in the liver, which is released into the blood. Glucagon binds to glycogen receptors, stimulating the production of CAMP, which activates CAMP-dependent protein kinase A. This uses ATP to add a phosphate to glycogen phosphorylase kinase A, converting it to the active phosphorylase kinase B. Glycogen phosphorylase kinase A uses ATP to convert inactive glycogen phosphorylase B to active glycogen phosphorylase A. Regulation of obesity using hormones. Persons that are obese have an increased risk of developing type 2 diabetes. Persons with a BMI of over 30 are considered obese, while persons with a BMI of less than 25 are considered normal. The adiposity negative feedback model postulates a mechanism that inhibits eating behavior and increased consumption whenever body weight exceeds a certain value. The adipose tissue is an important endocrine organ that produces a hormone called adipokines, which is a peptide hormone. It carries information about the adequacy of the energy reserves stored in the adipose tissue to other tissues and the brain. Further, one of the adipokines, called leptin, travels in the blood to the brain where it acts on the receptors in the hypothalamus to reduce appetite.